Alright, I said I'd post this video when I got 10 more followers that subscribed, and I got them. I'm going to start with basically, this is a recovery injury video for people who have nagging injuries, not full tears. You need surgery for something like that. Basically, I'm going to segue from something I talked about in the hair loss video with PRP therapy, which is what brings into the tb500 and bpc157 range. So the PRP therapy is, which stands for platelet-rich plasma, and it's basically blood that is taken from your arm. I mean, I guess they could take it from some other place, but everybody takes blood from arms, as far as I know. They take it, they put it in a centrifuge, and there the platelets are separated from the rest of the blood. They dispose of the rest, and then they take the platelet-rich plasma, and they can inject it. This is performed in a doctor's office. And it can be used to repair tissue. It's used on shoulders, it's used on knees in the NFL. It's not a drug. It's supposed to be performed by a doctor. I'm sure a nurse practitioner can do it too legally. Anyone can do it if they really wanted to and they're brave enough. You need a centrifuge though. I used it on my knees, and I've also used it on my hairline. Actually, you guys saw in some of the videos, I shaved my head and I got it done. I had 5 treatments and my hair is definitely thicker. So I just kind of wanted to throw that back out there rather than do a whole nother PRP video or hair treatment video. Anyway, the tb500, which is thyramycin beta 4, I believe, and bpc157 are basically the poor man's PRP therapy. You don't have to take out your blood or anything like that. It's basically a protein peptide. One comes in a container like this. The other one comes in a container like this. I'm not showing the labels because I don't want to really shout out any company specifically. And they are just protein peptides that work systemically, and they both have healing properties. Now, obviously, if you're injured, cost really isn't the biggest thing, but you will need 2 to 8 milligrams of the tb500, and it comes in 2 and 5 milligram bottles. The 5 milligram is not much more expensive than the 2 milligram bottle, usually. And the bpc157, you will need at least 3 bottles to run it for its course. Now, the tb500, you will need 4 bottles. If you do 5 milligrams a week, you only need to shoot it once a week. You can put it wherever you want. You can sub-Q it, you can neuromuscular it. I've tried both. I got results from both. I'm sure online it says something somewhere else, so I'm sure somebody will argue in the comments with me, but I've tried all this stuff on myself. So again, tb500, you take 2 to 8 milligrams a week for 4 weeks. Now, you should see any results that you want to see in those 4 weeks. I would not suggest staying on it much longer because apparently it's kind of like growth hormones in the sense that if you have a cancer in your body, it can actually expedite the growth rate, because all these do is heal connective tissue. So they can be used for a lot of things too. They actually have been used in ulcer treatment, Crohn's treatment, and any kind of lesion, I guess you could say, in the intestine. I don't know what the correct term is, but I think that'll fit, and you guys know what I'm talking about. Again, I try to keep this all in layman's terms, and because I'm not real good with the scientific terms, but I know what works, and I know the dosages. The bpc157, I personally don't like taking it as much. It works just as well. Could possibly work better, but you have to take 250 to 500 micrograms once or twice a day, depending on who you ask. Some people do it 12 hours apart, some do it once a day. A bottle will last you 10 days if you're doing it at that rate, and so you, again, will need 3 bottles, and that will take about a month. So BPC 157, 250 micrograms, that's pulling it to 1/10 on a syringe. And you'll take that again for 30 days. It'd be 3 bottles. And then you get the tb500, and that one will be 2 to 8 milligrams once a week, which makes it way easier than the other one, but you can use these together and they work synergistically. And you'll run that for 4 weeks. Now, obviously, if you have a serious injury, more serious than just like a pull or something like that, you may have to run a little bit longer. I had a really bad 3rd-degree sprain in my right ankle. And I ran the BPC for 3 weeks because that's all I happened to have on me at the time, and I was traveling. And I literally healed my ankle in those 3 weeks. I was not on crutches. I was not in a cast the whole time. I mean, I was hobbling around like a cripple for a couple days, but I've never healed faster. I also had a friend who I recommended it to. He shattered his forearm riding a motorcycle. He was going down a one-way street the correct way, and an old woman came around and was going the wrong way and hit him head on and shattered his forearm in multiple spots. So he had to get the surgery and the screws and all that stuff. And I told him, I was like, hey man, I don't know how this is going to work, you know, because you got metal screws and stuff, and that's not exactly going to bind proteins, you know, in this stuff. But he was like, hell, I got the money, let me give it a whirl. So he took both. He did the full 4 weeks on one. He did 6 weeks on the other. And his doctor was amazed. He never told his doctor what he was doing, but his doctor was absolutely amazed at the speed with which he recovered. And he was back in the gym in, I believe, 3 months benching. It might have been 6. But still, when you go from a shattered forearm on a motorcycle, which any of you have had some kind of serious injury like that, you know that you could be shot for life. So, I mean, it's worth it to research these things, you know, see where you can find them. You can get them online pretty much anywhere. As far as I know, it's 100% legal to buy them. There's a lot of clinics in South Florida now that are offering them. But as far as I know, because this is what I was told, and I'm not 100% sure on this, but it makes sense. As far as it goes, they are proteins that are found naturally occurring in nature. So they cannot be patented, I believe, as a drug. So if they can't be patented as a drug, they're probably not going to be trademarked as a drug. Therefore, they'll never be scheduled as a drug. That's what I was told. So that's why you see so many of these websites selling them, and they're still in business and not getting in trouble. And if they do get in trouble, it's usually because the website's selling something else that's actually a scheduled or a controlled substance. You know, there was a few websites that went down that were selling things like R4777, which is a synthetic opioid. You know, you gotta watch out for stuff like that. And they think they're gonna get away with it because, you know, it's just a weird number, nobody's paying attention. But got news for you. If it's an opioid or a painkiller or something like that, and somebody on the other end's taking it, odds are they're taking way too much of it. And something's going to happen, and, you know, when people start dying and stuff, that's when the government gets a little pissed off. So they'll come shut those people down. So make sure you buy your stuff from a reputable place. Take a look online, see what else they're carrying, because you don't want to be involved with people who are carrying too much stuff, basically. And the stuff that you know for a fact is illegal, because your name is then going into a database. So I'm not really recommending that you go this route, but, you know, people, you're going to go find it however you want to go find it, regardless of what I say. But just be smart about it, you know, because they're a hell of a drug. And, you know, if you go to a doctor down in South Florida, a PRP treatment is going to cost you $500 to $1,000 per treatment, and you're going to need 4 to 6 of those treatments. If you go again to a doctor for these treatments, the BPC, you're literally going to have to go every single day. He's probably going to charge at least $100 a visit. And the tb500, he'll probably charge you $250 a week for it. You know, so you're looking at $1,000. And if you know anything about the prices of these things, you could probably buy the entire amount you need for about $250. I've healed a wrist, an ankle, a pec. So, I mean, it's not just, it's really any soft connecting tissue it can heal. As long as the tear is not completely across, it will have some aid in it, which is also good because a lot of people get joint pains and pains that they got to take painkillers for, and this definitely helps to alleviate pain in joints and, you know, your back and stuff like that. So, you know, it can get you cleaned and off of other things too if necessary. So I hope this video is somewhat informative. I hate doing these things. I hate being on camera. That's why I'm staring off in the distance as I'm talking. I don't like looking at myself. But yeah, I mean, you guys got any other questions, shoot in the comments. I'll try to answer it. If I have to do another video for something else, I will. But I highly recommend them if you're injured or if you're in a lot of pain and it's something that's new. It's actually healed things for older injuries too for some people I know. It's just more unlikely. You know, fresh tear heals better, so to speak, as opposed to scar tissue. So if you got any questions, shoot in the bottom. If you like the video, please subscribe. If you don't like the video, tough shit. You guys are the ones who asked for it. And, you know, you guys got any other good questions or topics, you know, that you might want some information on, let me know. All right, thanks.